welcome to the Wunmi Bello Show. Every episode, I'll be bringing you unfiltered stories from old and new friends who've given me access into their most vulnerable and life-changing moments. Each conversation will take you on a therapeutic journey with laughter and refreshing relatability. Hello guys, welcome back to the Wunmi Bello Show. So today we're having a different kind of conversation on the show. We've never had one of these before, so I'm very excited. It's gonna be a good one. We are talking all things COVID-19. Now, on the 11th of March, 2020, we were told that COVID was a pandemic and we went into almost an automatic lockdown that changed our lives forever. Now, it's been 2 years since we've come out of this lockdown and a lot has changed and things are starting to look kind of normal. Things are starting to kind of go back to normal, but there's still a lot of questions in the air that I get confused by, and I know that a lot of people also get confused by, whether that is post-life pandemic, what that actually looks like, the vaccines, our mental health, and so on and so forth. So I just find it so necessary for me to have a conversation with a professional today to kind of really understand what life post-pandemic actually looks like. How can you prepare for it? What are the things that we need to do? What are the things that we need to know about the vaccine that can really further help us just get ready for what life is supposed to look like? So I've invited Dr. Joyce onto my sofa today. Hi, how are you?
I'm good, thank you.
How are you ready for this conversation?
I am so ready.
Now, I just kind of wanted to go back just a little bit to think about what my life looked like when right before COVID hit, because I know when it hit, it affected all of our lives in a really incredible, terrible way. It affected us so much. Now, when COVID hit, I just finished uni, and it was maybe like 3 months after I finished uni or something like that. So I was still very much like trying to figure out what life meant, like what is life, you know? And to get told, yeah, we're in a lockdown and we're going to be in this for a long time, like we don't know what's next. Of course, naturally, there's like a lot of worry in the air. I remember just talking to my friends, like all of us just panicking, like thinking, what are we doing? Like, what happens now? Like my savings, like I haven't got, like I wasn't working at that point. I had no idea what I was doing. So I want to even know in your life, what did life look like for you? Because I know that it was right before you were supposed to go into full-time work mode. You just finished at med school, right?
Yes, so first of all, thank you so much for having me on. I can't wait for this conversation. I think it's very, very necessary. So for me, when COVID started, guys, so I just graduated in 2019.
Yeah.
And so I'd had 4 months of doing perinatal psychiatry, hanging out with moms, actually being a doctor.
Yeah.
Quite nice, quite more of like a relaxing kind of rotation to start on with initially.
Yeah.
And then we had 2 months where I changed hospital. I started on the surgical department, but guys, I was literally just a junior doctor, learning what it meant to be a doctor, what I needed to do, what my new role was. It wasn't up to 6 months in, we were talking about COVID. And at first, I was like, it's not going to come to the UK.
Yeah.
There's no way it can come to the UK. You know, take it easy, one step at a time. And I remember I was actually in Nigeria when this happened. So I went on holiday for a week during Easter. And it was like, finally, this is coming to the UK. We need to all be very much aware of what's going on. My parents were panicking. Now, you need to understand, my parents are typical Nigerian parents. They were excited and proud to have their doctor. Yeah. And all of a sudden, they were questioning everything. And for me, I was like, okay, I'm supposed to go to work. Apparently, this is what I'm meant to do. Apparently, I'm a doctor and there's a pandemic. I've never, like in med school, if they told me in 2 weeks, in 2 years, or let's say even in 15 years, at some point in your career, you may be in a situation where you'll have to work when there's a virus where no one knows anything about. You have to go in there. Let's prepare you for this. Like there was nothing like that, right? So of course, 6 months into me being a junior doctor, I went straight into this COVID is coming. And then so we were like, okay, fine, preparing for that. And I went straight into ICU, dealing frontline with patients literally patients in ICU that had COVID, being very, very unsure. I was on the tube by myself. I felt like I felt like the driver was coming to just pick me up, you know, because I would go on the tube every day and it would just be me, get off, you know, listen to my gospel music on the tube, then get off, speak to my mom and dad, like, that's the only way they felt like they could literally be in control, or they kind of could help me through anything. But to be honest with you, just like you didn't know, just like we were all so confused on what exactly this pandemic was, the doctors or the junior doctors, I like to call myself a baby doctor, we had no idea what was going on. We had no idea how to prepare for it. We had no idea what the next steps were, which made it quite scary, because on one hand I was thinking, okay, they're saying it affects older people, but what if I'm that young person? You start having all these thoughts, right? Or it affects, mostly black and brown communities. So what's going to happen to my mom and dad? Like, you get all these worries, and then every day you're going to work, you're seeing a lot of things happen, and you're kind of trying not to relate it to your personal life. But yeah, I went straight into
working,
med school into COVID. Like, I had 6 months of
just waking up,
literally 6 months of introduction to understanding what a doctor was like, and then straight into like, this is your role, your job, get with it. And I just had no idea that would be my future, to be honest.
How did you navigate through that? Was it quite easy for you to kind of just adapt to that circumstance and just learn from it and just just tap yourself into that space?
I think at first, for me, when I was making that decision to go, like when I was like, I have to go to work. Like, there's no choice here. No one's, I can't say sorry, there's a pandemic, I can't make it to work today. I knew I had to go. So I think the first step was just telling myself, no matter what, go, and then we'll work through it. I'm so grateful for my friends. So luckily, because we had been together in the hospital for like 4 months together, we had people that we could support, like we could support each other. Because the truth is that no one else at home really understood. Like, you need to understand, like, everyone was scared. So I didn't want to come home and
scare them even more.
If I came on and I was like, Wunmi, this is what I saw today, you'd be like, what the hell does that mean? I'm going to, you'll panic, right? So I literally felt like the people at work was like, we had to look for a way to work with each other and to support each other. So I think it was really hard. I mostly relied on my friends and family, FaceTiming, and my colleagues and my friends at work during that time. And then it started becoming my new normal. So I never stopped working. I had to keep going in. But my days off, I had to also find a way to look for things that still made me kind of happy, still made me calm. My faith grew. Like, if I had to listen to gospel music during on my way there, that calmed me down. Like, they're just little things I had to pick up. I think mental health was definitely one thing that was just like, Joyce, everybody has mental health, but you need to take care of your mind during this time. Because if you didn't, it'd just take over.
Let's talk about what life is looking like now that we've kind of come out on the other side of the imposed lockdown. It's, in a weird way, it kind of feels like lockdown almost, and COVID just never really happened. It's almost like we've been forced to kind of go back to normality. So from your lens, what does post-lockdown or post-COVID look like?
So I think right now, we all want to be in like this post-pandemic situation state. And I feel like if you ask like the WHO, they'll be like, we're not past the pandemic, because there's still countries that are they have surges and they're still in lockdown. But for us, I think, for me, in terms of post-pandemic, it's for everyone to just be in the present. Like, it's really hard to know what the future is. It was really hard to predict what COVID was like. It's really hard to know what a new normal should be, how we should all behave. But for me, I just feel like post-pandemic is more about whatever you kind of want to make it to. So I feel like I'm being a bit more easy on myself. I think my friends are taking it more easy, just easing into things, traveling, taking up opportunities. I think it's probably better for our mental health to be able to feel like we're going back to a normal than to feel constantly like we're constantly being scared that something bad is going to happen or we're going to go back into lockdown. But I think it's hard to say that we're past the pandemic, definitely. But I think we all just have to like kind of rebuild our own versions of what this new normal is for ourselves. So I think my normal may be different from yours. I don't know how you found this normal.
I am just still so confused every day, and I think that even why, like, sometimes when I hear people talk about post-pandemic, I'm always just like, well, is that really a healthy way of us looking at things? Because it almost just feels, I don't know if it's doing like more harm than it is doing good, and I don't know if you can shed some light on that, but the idea of like post-pandemic almost makes it look like we should leave it as if it never existed or never happened and just kind of move on to a new life. And I don't like, what's your take on that?
I think that we should continue to obviously live our lives and try and be as normal as you want it to be. But I think we need to be extremely cautious still. Like we still need to be protecting ourselves and our communities. I think we need to be cautious that COVID still very much exists. It's just that we're learning to live with it. We're learning to, take the appropriate measures to make sure that we're not putting like people that higher risk at risk of getting COVID or things. So I think we should still be very much cautious of COVID. It's not gone, but it's definitely much better. Trust me. Like when I look at where we were 2 years ago, what hospitals were like 2 years ago.
Yeah.
Like you can't really compare in terms of what we were seeing then versus now. So I would say like it may be healthy for us mentally to also feel like, you know, things are getting better. I think if we always think things are getting worse, it's not really nice mentally. So I think it's okay to be positive about it, but I think we should also be cautious and also just learn from everything that's happened over the last 2 years.
Do you think, two questions here. So firstly, it's just about the state of, you mentioned that the state of the hospitals has changed from what it was 2 years ago. Describe to me what that change actually looks like now. Like what is actually going on? What are the circumstances in hospitals? What does it look like right now?
Yeah. So for me, mostly this year I've been working in A&E, and the second peak I was working in A&E. Now you need to understand that when COVID was happening, it was literally like, not what's happening, it's still happening, but when we were at the peak, so when in the last 2 years, it was every day, every person, so everyone was coming in with COVID.
Yeah.
Whether it was mild, moderate, or severe, they were coming in with COVID. And that meant that a lot of other conditions, a lot of surgeries, a lot of cancer treatments, things like that had to be put on the back burner, right?
Yeah.
So lots of people didn't show up. Lots of people were scared to come to hospitals. Lots of people didn't want to catch COVID if they got to hospitals. All of that was put on the back burner. Really, really stressful situations, but it was mostly COVID. Now, I wouldn't say anything has gotten better in terms of the number of people that are coming to hospital. It just means that we're getting all the other conditions coming in. We're getting everybody that has sat on that chest pain or that stomach pain for the last few years coming in now. And I think it just means that more people, I don't know, I feel like more people are conscious about their health. I don't know if more people are definitely more conscious about their health, so they're coming in and double checking, which is extremely important that they do. But we're still seeing a lot of people coming. It's just every other condition that almost got ignored during COVID.
And how is that? How is handling that as a doctor?
Yeah, it's really hard. I mean, at the end of the day, I feel like I've been a little bit resilient during this. I've noticed that I'm actually a bit, not stronger. I don't want to say stronger because I don't need to be stronger as a doctor, but I think there's a way that the skills that I picked up in the way I spoke to what I've learned during COVID, and the way I speak to patients now, and I speak to people now. I mean, patients are people, right? They just they come when they feel worried. And for me, as long as my patient feels like they feel like they're being listened to, you can explain exactly what's going on, why they should do this or why they shouldn't do that, and they feel leaving okay, then I feel okay. So I think for me, it's not easy, but at the same time, as long as I know that people are feeling listened to at hospitals, because I feel like a lot of people were definitely scared of coming to hospitals with everything going on, then I'm okay. But but I mean, the reality is, before COVID, medicine has always been busy. So nothing has really stopped. It never stopped, or it just went, it peaked, got better, peaked again, but it was just different things causing the peak.
Let's talk about the urgent need to kind of just discuss the mental aspects of what COVID, being in COVID and being in lockdown caused for so many people. I saw it in my friends. I saw it even in myself, like in terms of just how I felt being around people, being by myself. Like it really, really affected a lot of people mentally. I remember not too long ago, I attended my old universities. It was kind of like a talk through day. I had to go in, just talk to a bunch of new students in first year. And one of the most prominent questions I was being asked by a lot of the students was just, oh, my mental health, like how do I find confidence in myself? And it just, so many kids were asking about confidence and like how do I find that in myself? And I remember just thinking, and when I asked the lecturer, like, where does this stem from? Like, why is there so much question around confidence, understanding things and feeling comfortable around other people? She said it's obviously just because of, off the back of like being in lockdown for so long. So from your lens, what do you make of that? Because I know that this isn't a conversation that's like isolated to one person or one university or one individual. It's very much a thing that's affecting so many people. So what do you make of that?
I think mental health and like mental health conditions like anxiety, depressions, there was definitely a peak during COVID. And this was with people that already had previous mental health conditions and actually just new cases in general, especially for the younger generation. I can speak on like my cousins, my younger cousins especially. I can speak on myself, on my friends, my mom and dad, like my mom and dads, my aunties. Everyone went through something. Whether or not it was that they felt alone, or so they felt worried going out, or the fact that they felt like there were too many people in the house and they were living with people, like it was too much, or they already felt low and COVID and the fear just made everything even worse. So I think especially with the 18-year-olds and 17. Imagine you before the pandemic, you're 18. After the pandemic, you're 21. You're supposed to be
massive
an
change.
adult.
Yeah.
So all the emotional intelligence, the things that you pick up in terms of interacting with people, all those skills you haven't actually built. They haven't had a chance to actually use those. So I think for me, as a healthcare professional, as a person, I think I had to pay attention. Like I said earlier, I had to pay attention to my mental health. And I think a lot of conversation still has to be made. I think it's probably the most common effect of COVID. It's probably the most common thing that came out of the pandemic. I think there's data that showed from mine that 1/3 of adults and young adolescents actually felt like their mental health had deteriorated since March 2020. A third. That's a lot of people, and that's not everybody that they've asked. So I think definitely we need to talk a bit more about mental health. We need to look for ways to actually cope with it and actually feel comfortable having those conversations.
What advice do you give to, you know, those people you're speaking of, myself, yourself, the younger generation, the older generation who did have a mental side effects from, you know, COVID? What advice do you give them in terms of actually navigating, getting themselves back to what they were pre-COVID?
Yeah, I think that's a very important question. I think my first thing would be to say be easy on yourself. I think it's so easy for us to be so hard on ourselves and put this pressure on to just go back to normal and to hang out as we're meant to and to see that those people. And you know, I think we need to be easy. Just like I'll tell you, Wunmi, like take it easy. It's okay. Like I know you're going through a lot, or that was stressful. Like sometimes we need to be able to tell ourselves that. And I remember when I was during the pandemic, people ask you, how are you? And I'm like, no, I'm fine, I'm okay. But one day I was just like, how am I doing really? Like, should I tell you how I'm really doing? And when I started asking myself that question, checking in on myself every day, then you know how to kind of like navigate yourself. So I think one thing is to be easy on yourself. Second thing is to check in on yourself every day. Just like you check in on like, oh my God, I woke up and my throat is sore. I have a headache. I'm worried about this. Like check in, how am I actually really feeling today? Like if I'm not doing okay, what are the things I could take off that list? What will make me feel a bit better? Pick up things that you actually enjoy doing.
Yeah.
And the third thing I would say is to actually ask for help. It's so hard. I feel like a lot of people don't know where to start in terms of asking for help. They feel like it's not that serious to ask for help. It doesn't matter how mild you think your symptoms are or how severe it is. It's so important that you reach out to someone. It could be, you could start with family, but really your GP is probably the best bet to start off with in terms of just having those conversations and knowing what the next step could be for you. But please don't suffer in silence. I think that would be one of the main things I would say. Don't suffer in silence and just check in on yourself.
One thing that I've definitely noticed is that, you know, post-COVID, there's been so much more conversation around, you know, having therapy. And a lot of my, even me, like I went to therapy post-COVID. A lot of my friends, you know, went to therapy. But one thing that I've definitely noticed is that because so many people have now wanted to take up, you know, this going into therapy, there's been a decline in terms of how much therapists are actually available to, you know, help you and get you back into your, you know, regular state of mind. Now, with that being said, do you feel like the government are doing enough to actually support people who suffered mentally off the back of COVID?
So I think that's a very big question, right? I think for me, there's been, the NHS has recognized, first of all, that mental health has been already before COVID. There was a lot of investment that already needed to go into it to make sure that people were getting their treatments as they were meant to in the right amount of time. I feel like just from doing like brief reading, the government have put more money into mental health services and ensuring that we're able to improve access to mental health services. But I feel like I don't know if there's enough investment yet. I don't know if that's definitely answering all the needs. I don't know if everybody's getting the treatment at the time they should get it. Actually, I know that they're not getting, you know, we have waiting lists still. And with mental health access, we need to make sure everything is it needs to be at a timely manner. Losing 1 minute or 1 hour or 6 months can make a massive difference in an individual. So I think we definitely need to speak up more in terms of improving investment into mental health services and ensuring that the NHS is able to take care of and provide services for people who are going through mental health conditions and problems at the moment.
If we're going to be very like specific, what are some of those steps that you think can be taken by the NHS, by the government, to actually ensure that, you know, things are being put in place and they're not just being put in place, but put in place accordingly to actually help the lives of those who've actually suffered off the back of this?
Yeah, I think this is all in my opinion, right? I think first of all, we need to start with schools and universities. We need to start, like, it's a level thing. Okay, many people, we can't, we can all say go to the GP, right? But we can also target where everybody is. So in terms of students, we start with schools and universities, ensuring that they have enough support to be able to support their students there.
Yeah.
We've had a lot of students actually commit suicide in the last few years and die because of mental health, like feeling depressed and feeling really low. And so we need to continue to support universities and schools in that. Then when we go up into the mental health services as part of the NHS, we need to improve funding. Funding is always going to be needed. We need more healthcare professionals, we need more therapists, we need more nurses. And then on a global, on a higher level, I would say more conversation around reducing the stigma, because a lot of people don't even come out to say, this is how I'm feeling, because they're so scared of being judged. So for me, we also need more education, more investment in educating around mental health conditions and saying that, look, we know what you're going through. A lot of people are going through this a similar thing as you. Don't be ashamed of it. And we're actually here to help. And I feel like we need to hear those conversations a bit
way more. Yeah, definitely.
Like if I'm not hearing it anywhere, how am I going to come up and want to say, hi, I'm feeling like this, you know? And I felt like, just as I was saying, when I was in hospital and we were all going through something, we were all going through the pandemic, we could all say, oh my gosh, I'm so stressed right now. That patient made me feel, and I could put my hand up and say, this is how I felt, so someone could help me out. But I think we need to think about it in terms of institutions, so schools, universities, then the National Health Service, and then start doing more education around mental health conditions and actually trying to reduce that stigma. And that's also speaking about Black communities. I know, being Nigerian, now more people are speaking about the mental health. But before COVID, no one was speaking about mental health. It was no, don't say that on your, don't talk about it. And I feel like after COVID, I think COVID has actually made people more aware, because everyone has had their own experience, whether there's a spectrum, right? But you've had your own experience of trying to make sure that you're feeling okay mentally. So I hope we continue the conversation around reducing the stigma, creating awareness, and making people comfortable.
Because you just brought up the Black community, and I think for me it's really important just to have a specific and quite a direct conversation to the Black community when it comes to our mental health well-being, especially post-COVID. What advice would you give to those young, old, who are currently still suffering, trying to process life, trying to navigate life in this new way of living within the Black community specifically, considering our background and, watching our parents struggle for so long, and, now we have to morph into this new version of ourselves to almost survive in this new way of living, because so much has changed. So if we're speaking directly to our community, what advice would you give them?
I think, just like I said earlier, is you're not alone, and there's nothing wrong with you if you're not feeling yourself. And if you're not okay, no one else around you is going to be okay. Because I think it's something in our community where we want to take care of everyone else around us. We want to make sure that our moms are fine, our dads are fine. Our moms want to make sure that their daughters and sons are fine, their cousins. And so I think the main message here is that you need to take care of yourself, and then you can take care of everyone else. And there's no stigma. There shouldn't be any stigma around mental health conditions. You have been through a lot in the last few years. It's been hard. Whether or not we're going back to normal and we all want to kind of pretend and push those COVID scars away, we have been through a lot. So I would say continue, be easy on yourself and speak to someone. There are people there to actually speak to you about things, and of course start with your primary care physicians, but again, you can actually speak to family and friends first, who can help you make that decision, who can help you or take you to the doctors, who can help make that phone call for you, because I think people are just scared of picking up the phone and being like, I don't feel great.
So one thing that we've spoken about off camera that I really enjoyed that conversation, because I think it's important, we were talking about short-term side effects of COVID and long-term side effects of COVID. I think that is something that is definitely being spoken about a lot, but I think there needs to be a lot more thoroughness just in terms of what that actually looks like. So walk me through what are the side effects and what that actually looks like moving forward.
Okay, so with COVID, I think initially no one really knew. Everyone was talking about the initial infection of what you get, and then now that everything has happened, you're seeing that people have long COVID. And long COVID is almost causing more problems than anything for lots of people now. So I would say short-term symptoms would be you're feeling achy, you have the flu, you're coughing, chest pains,
all the things that most people would get, the milder symptoms that you got when you knew that you had COVID, headaches, things like that. And unfortunately, I would say a short-term symptom could also be death, because in the first 10 days or so, people do obviously have died from COVID. In terms of long-term symptoms of COVID, so this is after you've had COVID, sometimes you have symptoms that linger. A lot of people complain about tiredness and just not feeling themselves. Like they never got over how drained they felt when COVID happened. I have lots of people that lose their smell and taste and actually don't get that back for months. Some people got them back in like 2 weeks. Yeah. But you also have things like breathing problems that you may continuously have. You may have inflammation of your heart and things that actually stay a bit longer. Yeah. You may have problems with your kidneys. So there's so many like larger effects, longer term effects of having COVID that comes with the infection. And again, if you also have had serious COVID where you've had to be in ICU, all the complications that come with being in ICU and being put on a machine and things like that also linger for months. So I think it's very important that we understand that yes, some people just get COVID, don't get any symptoms, and it's okay. Some people get COVID, get the mild symptoms, get body aches, and it's fine. But some people get COVID and die from it, and other people get it, go over the 10 days and actually live with the symptoms for way longer. And that's what we're trying to almost avoid, for people to have these serious illnesses after.
And so when you say you're trying to avoid, what are the measures being taken to actually avoid that? Because one thing that is a massive topic point in my group chat is about the tiredness that one specific friend of mine has been feeling since she's had COVID. Like it's like a constant tiredness. And I've heard this from more people, which is why I'm asking this. So what are the things that are being put in place to figure this out? Yeah.
So I think, again, with COVID is new, right? So they're constantly doing research in terms of when you say you're feeling tired, you tell your GP, that's recorded somewhere and there's research going on there. The main thing people or the organizations are doing now is the vaccine to first of all stop you from either getting reducing your chances of getting COVID or reducing the chances of serious illness from it. So that's one of the main things. Again, it's going to be protecting yourself, ensuring that you're wearing your mask. The main thing is trying not to get COVID and trying to not have a serious to reduce your chances of getting a higher serious complications from COVID, which right now I guess is the vaccine. Yeah.
Do you know what, that segues me really well into talking about the vaccine, and also just what you said about, you know, wearing your mask. And these were all things that were very much mandatory before. It was like, wear your mask, you can't travel, you must be vaccinated, all these things are mandatory. And to an extent it was like, okay, cool, things are being sorted, things are being regulated, and within months it was like all of that stuff was stripped away. So for me it's like exhausting and almost frustrating to like be put in a position where it's like, I want to trust the government and I want to trust that they have my best intentions, and you know, they're doing things accordingly, and they're doing the necessary protocols to ensure that things are being done correctly, to ensure that we kind of go back to a regular living. But when changes are being made so quickly, it's like 1 minute wear your mask everywhere, you have to get the vaccine, you have to do this, all of a sudden travel restriction, all is fine, go to Ibiza, go to this, do whatever you want. It's like, where does that come from? And also, like, just from your lens, how are us, as the humans who are taking in all this new information, how are we supposed to trust and have faith that the government are acting accordingly to ensure that things are being done properly?
Yeah, no, I totally get, even as a doctor working in hospital, you hear all these, every day there's something new that comes in, right? So someone is telling you why they can't wear a mask today or why they shouldn't wear. So I understand why everyone is confused. But again, we need to understand that COVID, no one has ever experienced COVID before. A pandemic has not happened in our lifetime, right? So as we were understanding, as they were kind of understanding what COVID was, as they were kind of, you know, breaking down in terms of what we should do, what treatments to go to have, things like that. The government was working with scientists on a daily basis. Every day things were changing. Every day we were learning new things. And so every day as the situation changes, restriction or a rule or a policy changes. And for us, it just feels like, are these people, like, do you guys know what you're doing? Like, how come you're telling us to wear masks, now you're not telling us to wear masks? But they're working in terms of looking at the numbers. The reason why we went into lockdown is that there was a huge peak. People were dying. The NHS was at at its worst. There was, we didn't have enough doctors to deal with the demand that the people that were coming in, right? So they needed to get everyone indoors to try and stop the spread for COVID.
Yeah.
So stay indoors. Then things started getting better. So we said, okay, there isn't that much pressure. Let's people start coming out again. And then we almost went into a second peak. So everybody go back indoors. Then we got the vaccine. So the vaccine, everyone started taking the vaccine. Less people were getting sick from it. There was less pressure on the NHS. So it's like, okay, so let's start easing things off slowly. Now when we look at it, it looks like, oh my gosh, we've literally went from like 0 to 100. Just like we went from like 100 of like living life to like 0 of nothing in the beginning. But it's all based on like time. It's just based on data they were getting every single day. Again, I don't work for the government, so it's really hard to be able to even sit down and know exactly what their thought process is. But I know that with COVID, even as a doctor, things were changing every single day in terms of how you manage it, how you treat it. And this was on an international level, not just a national level. Yeah. So you're listening to organizations, you're listening to scientists, and everyone's coming together and making that decision.
When we're talking about data and you're obviously mentioning that everything's going off the back of like the data that you've been given, right? What exactly as the civilians, what should be done by us right now to kind of prevent us from getting COVID? Is it the fact that we need to take the vaccine? Is it the fact that we need to take the boosters? Is it the fact that we need to wear masks? Like, because nothing has actually been set in stone in terms of, okay, this is A, B, C. It's very much this means this, but could also mean this, or could also mean that.
Yeah.
So what exactly, if you're speaking to, especially within the Black community, because for me, this conversation is very much, because I feel the fear within the Black community when it comes to taking the vaccine and just everything around it. So what is the data actually showing right now? Yeah.
So it's encouraging you to take the vaccine, okay? And for me, I'm not here to say take it or don't take it. For me, it's about you making informed choices on what you would like to do and what decisions you would like to make. For example, when they said don't wear masks anymore. Yeah. Personally, for me, I had to actually think about the rationale behind that in terms of I'm going in the tube, I feel extra cautious, I feel a bit more, I don't know, I just feel a bit more wary about being around people still, those type of things, right, in terms of the social anxiety we're speaking about. So for me personally, even now, I still wear my mask in the tube just because that's a decision I've made for myself. So we would say to still protect yourself in terms of if you're in large areas, if you're not vaccinated, to make sure you're still wearing your mask and still protecting yourself in terms of social distance and things like that. But because more and more people have been vaccinated, we have less COVID, like less cases around. So the chances of you getting COVID is reducing, but has not disappeared. Again, as I said, I would encourage the vaccine. That's what the world and WHO, who we mainly follow, right, would encourage you to get the vaccines to make sure that we're fighting against most of the variants that are coming in and preventing you from having serious disease. But I just want to make it clear that it's important that you actually make that decision for yourself. Don't feel like you're being forced to do anything. There's a lot of resources out there, but it's important that you also make decisions based on trusted information that is out there, rather than like hearsay.
There was I know there's a lot of, like you said, there's a lot of people who've taken the vaccine. It's been, very beneficial. We've seen in the statistics and everything else, but there's definitely not enough light being shed on those who have suffered at the hands of taking the vaccines. I literally was at my concierge, and I've shared this story on various of my other platforms. I wanted to bring it to you personally, but I bumped into a woman at my concierge who was previously a doctor who had sickle cell, who ended up having to take the vaccine at the time when it was mandatory for doctors or people who work within the department to take the COVID vaccine. She took it and she ended up completely being disabled. She's not able to use her arms, she's not able to use her legs anymore. I literally spent hours talking to this woman downstairs. Like, it was, her story was like crazy to me, because literally she was, like yourself, a practicing doctor at the peak of her career, at the peak of her journey, living her life, to now completely changing her life around, and like, just, you can imagine the state that she's in. So for me, why aren't those stories being shared as much? I know that, of course, like the vaccine, well, based off of like what data says, the vaccine is helping people, right? But the reality is there are certain people who it's not helping, and who are having, terrible circumstances or consequence, following taking the vaccine. So when you hear a story like that from your lens, does it make you change how you see the vaccine, or is there anything that you can shed light on when it comes to, just following off the back of the story that you shared?
No, first of all, that's cool. It's really unfortunate, right? Because the thing about any medication, any vaccine, anything you take, you're going to have side effects. You're going to have side effects that are common and side effects that are very, very rare. And unfortunately, even you may be that one person that gets the rare side effects. And for me as a human, I don't care if, I guess it's like, yeah, you're saying 1 in 1 million, but if that 1 in 1 million is me, it stresses, that would stress me out. So in terms of the vaccine, there are side effects from it. There are severe there are rarer side effects. There are increased chances of you getting clots, things to do with your heart, stories like this. I can't comment on this particular case because I don't know what her full past medical history is like. I don't know what medications or anything that she was necessarily taking. But I think the question is more towards why don't we hear a lot more about it? And I feel like it's almost like you have people trying to push something that is doing more good than harm. So they're probably not trying to focus mainly on the negatives. But if you actually watch the news and you actually see what's going on, like for example, because lots of people complained about the side effects they were getting from, like, I think Johnson & Johnson's on one of the vaccines in America, they've actually limited who actually is able to have those vaccines. So no one is actually trying to hide this information. I think it's important that if you go online, before you sign anything in terms of the vaccine, it will show you all the possible things. Again, it's almost a work in progress. They're still trying to get the vaccine, they've gone through all these clinical trials. You've tested it on thousands and hundreds of thousands of people, but now you're testing it on a larger scale, on millions and billions of people. So of course you're going to have new conditions that are coming, and they're constantly testing and researching what these side effects could mean, and what if they're temporary, if they're permanent, things like that. So I think no one's actually trying to hide that information. I think it's just one of those things where, because there are not that many people coming up with the same thing, lots of people, it doesn't get covered. And that's more, I guess, I don't know if it's political or anything like that, but it just doesn't end up getting covered as much as the people that have actually benefited from it. But with any medication, vaccine, like anything we put in our bodies, there's so much, like even paracetamol, the side effects from it, if you read the side effects, you probably wouldn't even want to take it as well. So we need to be just extra careful.
I posted a question on my socials the other day where I was just asking, like, what are your biggest fears when it comes to vaccines? If you have any question that I can, like, share to you. And one of the main one that I wasn't even aware of was definitely women who were like, I've taken the vaccine and I've seen a massive change in my menstrual cycle. Some women are saying that they no longer even see the menstrual cycle. Some women are saying that it's decreased in terms of, how heavy it is, etc. So I guess the question is, for those women, what can be done, or are things being done to actually find out whether or not this is a side effect of COVID?
I have that question asked like all the time as well, because I think lots of people have had changes in their menstrual cycle. And what I would say is there's research to show that having the vaccine has changed people. So either it made their bleeding heavier, made it less frequent, made it lighter, but it's all temporary. And there's no evidence that it affects your fertility. So I think to anyone that is experiencing that, the first thing for you is to always go and see a doctor. If you're experiencing anything that has to do with your menstrual cycle not being as regular as you want it to be, or you're worried about it, it's always good to go and see a doctor just so that they can rule out any other causes of it before it falls on the vaccine, first of all, okay? Just to make sure we're actually doing a proper look at the patient, right? So I would say definitely there has been evidence. I think there was a CDC, like on the CDC website, if you actually have a look, they have said that there is evidence where it actually affects the way your cycle is, but there is no evidence to show that it affects fertility at all. And of course, there's still ongoing research all the time to make sure that they're looking into this. Because even me as a young woman, I want to make sure that in a few years' time, they're not telling me anything funny. And I think as they are doing more research on the vaccines, as they're making new changes, that they'll consistently be looking at all these complaints and things to make sure that it's safe. But during the trials, there are things that come up, there are things that they look at, and the type of vaccine they've used has never shown to actually affect infertility for what we know right now, right? So I think there's definitely more research going into it. Right now, no information shows it affects fertility, but people are right to say that there's definitely been an effect on their menstrual cycle.
Is there an explanation as to why it's been such an effect on the menstrual cycle?
I'm not sure. That's what they're doing the research about, and I don't want to answer anything that I'm not 100% sure. So I think hopefully in the next few months we'll be able to like get more research around that and why that's affecting it.
How likely do you think we'll reach a new pandemic or another pandemic or another disease?
I I think that's such a hard question.
I know it is, but I have to ask.
Yeah, like I just don't know. I literally can't predict. I would have never thought like we would experience something like COVID, right? I think it's just so important for countries and it's more government to actually make sure that we're always prepared for the next thing. Like, I think it's better to be safe than sorry. So I think it's really hard to say. I think for now, it's better for us to almost concentrate on the one thing we have, that we can kind of control and move on to like the next thing. And in terms of even historically, when we've had like pandemics or anything in the past, or we've had diseases, they've all kind of thankfully been controlled. And that's thanks to research and science and things like that. So hopefully, I hope our governments and our health organizations and things are actually making plans and actually making preparations so we don't have to go through what we did over the last 2 years. But it's really hard to say.
And I think that's definitely it for me. It's like, considering, how COVID-19 was handled, do you feel like if we were, God forbid, fingers crossed, we were to ever go through another, circumstance similar to COVID, that there's enough things or measures have been put in place to ensure that we don't go through it in a similar light that we, COVID-19, how we went through COVID-19.
Yeah, I definitely would hope so, because I think, in our lifetime, we didn't experience a pandemic. We didn't have enough hospitals, we didn't have enough beds, things like that. And I feel like from the first peak to the second peak, even just seeing that difference, of course we were still struggling, but there were more protocols. We knew where we needed to go. We knew where this patient, what needed to be converted, how we converted surgery to like theaters to ICU, things like that. There were more processes that had been, processes that have been developed because of COVID. So I'm hoping that while COVID is, I think the best time to work on anything is when it's not like at its peak. So I'm hoping that now we still have, and it's still ongoing. There's still research into like vaccines and what exactly COVID is and variants. So I'm hoping that as we're kind of in this section where things feel a bit calmer, that's when scientists and governments are actually working harder to make sure that they're doing what they need to do to prepare us in case of anything. But I genuinely think that we'll be definitely more prepared than we were 2 years ago. But probably more work and investments and things need to be done, definitely.
I really want to ask you like a real question, right? Because I think early on in the conversation when I was talking about, there's a lack of trust when it comes to, the civilians and, the government and just anyone working within the NHS healthcare department, and unfortunately you are definitely under that bracket for a lot of the viewers and for myself, to be honest. Where it's like, are you saying a lot of these things that you're saying because there's a certain guideline that you need to follow through, or am I speaking to Joyce, like almost like the human that is, almost ensuring that everything that she says comes from like a human standpoint, and ensuring that other people who want to have more information about COVID actually know the truth rather than like following through a guideline. So I guess my question is, with a lot of the stuff that you're saying, and like a lot, because you've been so honest and you've been very thorough with a lot of things that you've been saying. So my question is this thoroughness coming from a place of following through with guidelines and ensuring that you're protecting, the NHS, and you're protecting the government or whoever, or like whatever that protection state looks like, or is it coming from this is just sheer fact and this is what I know essentially? Yeah,
to be honest with you guys, anything I say here is, in my opinion, it's in my best. You need to understand that I went through a lot during pandemic. I didn't even, in terms of government, NHS, working for it, everything, right? And for me, I'm more worried about my family, my friends, people I'm meeting, my patients, and making sure that people actually feel comfortable, people feel like they're being heard, because I see that and I experience that every day where people just feel like no one is actually listening to them. So speaking to you now, the only contract I ever signed is to make sure I do no harm to my patients. I put my patients first, have no contract with anyone else to tell me how or to behave or what to say or anything like that. There are things that I would advise because I'm using information that I know is out there, that I know has been proven to be good, But if there's anything that I'm not sure about, I won't talk about it, and I won't encourage anyone to do it. So I think it's important that you know that like this conversation we're having today is genuinely from me. Someone could come and hold me accountable, but it's not to do with any government or any guideline that I have to say or anything like that. I think it's important that you have people that you can relate to, that you have people that don't feel like, you're a doctor or the NHS and the government and we're just, people are just making decisions for us, because people are making decisions for me. I'm literally you. I just work in a hospital. I had to get the vaccines before anyone else without knowing whether or not I should take it as well. I had to go in to go and work in a hospital before I actually knew what the pandemic was. So I've had to put my own life at risk just because I feel like I had to, that there's no way I'm going to allow my friends and my family or anyone watching this to go through a similar thing, being confused or being led astray or anything. So I think it's important that people know that, look, there are people that actually care. There are people in hospital. With my patients, like, I genuinely want to know how people are feeling. I think it's extremely important that you open up to people and you just share how you're feeling, because that's how we can actually make you feel slightly better, even if it's just reassuring you. I feel like lots of the things I do in hospital is reassuring people. So yeah, everything you hear from me is from me. Maybe they'll come and get me. Maybe like, I don't like what she's saying, but that's not my business.
But I do want to know, because I think you've said so many important things and you touched on very important points that I know people want to know about. I think in the next, because none of us really know what the next 5 months, a year, 2 years looks like, and I think you might have a better scope as to what that might look like. So for you, what are the things that we can kind of put in place to ensure that we're mentally, physically prepared for what the next post-COVID life looks like, but also what is post-COVID life supposed to look like?
As I said earlier, like, post-COVID life, I don't even know. Everyone's post-COVID life is going to be different. I think right now, what I would say is to live in the present. Yeah. You want to travel. You want to stay at home. You want to hang out with your friends. I think everyone has to just kind of sit down, have that time with yourself, and understand what normal is for you. Because if I tell you what normal is, my last 2 months of normal has literally been, I went back home to Nigeria, which I haven't been able to do properly since the pandemic, right? And I literally just spent time with my mom and my dad, because that was not normal for me for the last 2 years. And then now that I'm back for the next 2 months before I go into a crazy training program, my normal is going to be hanging out with my friends. It's going to be maybe traveling. Do you see? So I feel like it's literally according to what you want it to be. I think definitely be in the present. I think definitely still be cautious. So let's not get carried away and act like it doesn't exist at all. We don't need to think about COVID every single minute, but just knowing that, you know, you could still get COVID, you could still get COVID, and that's okay. Rehabilitate, recoup, and get back to it. But I think everybody's normal is going to be different. But I think just be present in the now and just do what you actually want to do. I think after COVID has happened, you shouldn't be following it. Just actually do what you want to do and live your life as you would.
Thank you so much, Dr. Joyce.
Oh, thank you.
This was necessary, and I'm happy you came onto the show, so thank you so much for coming on.
Thank you for having me. I hope it was okay.
No, it was great. Thank you.
Perfect. Guys, are you sure I didn't waffle?
No.
Oh my God, I was talking.